Drake has already asked whether you had a good night's sleep or not. We will let him explain how to get one if you didn't. So, Drake Shepard, you are up, sir.
Oh, hi. Thanks for coming. We spend 1/3 of our lives sleeping, so it would be a good idea to discuss it. It's rarely talked in public because when you talk about it, it's intimate and you're vulnerable when you talk about it. So in talking with others, most people say if they didn't get a good night's rest, oh, I tossed and turned all night, I could use a nap, or I just didn't sleep well. All of us has had some sleep issues in our lives. 1/3 of all Americans do not sleep. So 50 to 70 million adults have a sleep disorder, which we'll cover today. All creatures sleep. It is a vital component to live. Sleep is an essential function that allows our mind and body to recharge. It keeps us healthy, wards off diseases, improves memory, repairs muscles and tissues, and helps the immune system. During sleep, activity still goes on in the brain, processing memories, elimination from of waste from cells. It affects our mood, consolidates our memories, impacts our memories, and alters sex drives and improves thinking and concentration. So, the amount of sleep we need is highly dependent on age. Newborns need about 15 hours of sleep, and as you get older, you need less sleep. And particularly with adolescents, teenagers, they go to bed later and wake up later, so their school time needs to be at about 8:30 in the morning. Many school districts, many states have laws stating that they need to go to bed, these school kids need to go to school at 8:30, and there are laws for that. Excuse me about that. And how much sleep do we need? Well, it decreases as we get older. So adults need about between 7 and 9 hours of sleep. And some people are naturally short sleepers and require less than 5 hours of night to sleep. This is due to a gene variation that causes this. Getting enough sleep means your brain has enough time to get through a full sleep cycle. So older adults take longer to fall asleep and wake more frequently with increasing age. Mature adults spend the same amount of time resting in bed, but spend less time asleep. So as we get older, there's a delayed onset of sleep, more of an early to bed, early to rise. That's why things close down here at 8:30. Reduced REM sleep, which we'll get into, rapid eye movement, fragmented sleep, and daytime napping. This changes as we get older. So sleep issues get worse as we age. This could be due to heart and lung functions that are impacted, acid reflux, painful conditions, osteoarthritis, urinary problems caused by enlarged prostate in men, or an overactive bladder. If you have an overactive bladder, you could take Detrol LA or Tobias, for instance, that could be prescribed. And there are mood problems and medication side effects. So this all relates to the circadian rhythm, which is a natural internal process that regulates the sleep-wake cycle based on a 24-hour cycle, or Earth's rotation. It is our internal clock or master clock that we all have. During the day, light exposure causes our personal clocks to make us wakeful and active. As night falls, the body produces melatonin, or hormone that produces sleep and keeps sending signals to stay asleep. Circadian rhythms influence our weight, metabolism, mental health, and immune system. So when you wake up, then things start to cook. You get sharp, high blood pressure, the melatonin stops, you get alertness, coordination, reaction time, more muscle strength, high blood pressure and temperature, and then things slow down for the other third of the day. And the same thing here. And if when thrown off course by maybe medications, recreational drugs, upsetting psychological trauma, jet lag, working nighttime jobs, or even constant artificial lighting, quality of sleep is disrupted. Sleep problems can occur, such as insomnia, excessive sleeping, sleep apnea, or not staying awake during daytime. And they occur with pets and animals too. Again, so we wake up, cortisol is released. Cortisol produces stress in our system, which is good to have. It keeps you aware. Too much of it for too long a time isn't that good either. So you get more higher blood pressure, alertness, temperature, and again, you slow down then. The hormone melatonin is produced in the pineal gland in your brain and sends internal signals at night to sleep. When our bodies have a low level, a melatonin supplement can be purchased at a low cost to help out. The pineal gland is behind your temple, for instance. And a supplement called melatonin can be purchased at various different strengths. And looks like that. Our brain is 2% of our body weight, yet it takes 20% of our total energy to run it. Thus, it takes hundreds of calories a day to power it, plus enough water to hydrate it, and runs with different patterns when we sleep. During the first hour of sleep, the brain progresses through stages during which brain waves slow down. Slow wave sleep include muscle body relaxation with heart rate, body temperature, and blood pressure all falling. So stage 1 is falling asleep, producing small brain waves known as alpha and theta waves. Can everybody hear me? Alpha and theta waves. As one becomes drowsy. This lasts between 5 and 10 minutes, and at stage 2, the brain becomes slower than stage 1, lasting more than 10 minutes. So there are different stages. And at this stage, the heart rate and blood pressure decrease to get one into a deep stage. And at stage 3, delta waves or larger waves begin to occur, delta waves. So it looks like this. When we're awake, we have these kind of brain waves. When we're drowsy, then the alpha waves take over and get longer periods with higher intervals. And then the theta waves take over. As you can see, they're increasing in length, in highness and lowness. And slow wave sleep, which is stage 3 and 4. So we go through these stages when we sleep. So again, stage 1, the breathing slows down. Stage 2, it's an onset sleep. The temperature drops and the heart rate slows down. Stage 3 is deep sleep, where you get the delta waves and the muscles get relaxed. And stage 4 is very deep sleep. And we'll talk about REM in a little bit, but you go through these different stages as you sleep. Stage 3, delta waves or larger waves begin to occur, and at stage 4, deep sleep, it is hard to wake someone from this cycle. In this stage, the body physically repairs itself, boosting the immune system and restoring muscles, tissues, and bones. So, what happens to your body when you sleep? Well, your brain is busy clearing out toxins and processing memories. Your lungs slow down, your breathing becomes more regular, your muscles are being repaired, and you release growth hormones, and your stomach, your digestion slows down, and your heart rate and blood pressure all do. So when you sleep, you'll have 4 probably separate sleep cycles in each night. And each cycle lasts about 2 hours, about 90 minutes to 2 hours. So therefore, 4 times 2 is 8, which is how you get your 8 hours sleep. During that sleep cycle, at the end of each cycle, you have a REM time, which is rapid eye movement, or when you start to dream, and that lasts for between 15 and 30 minutes. So therefore, you're going to dream approximately 2 hours a night through different stages. And with REM sleep, that occurs at the later part of a sleep cycle, you get your regular and shallow breathing. Your eyes dart back and forth because your eyes scan things underneath your eyelids, and you get temporarily paralyzed. We get paralyzed when we sleep in REM because we don't act out our dreams. If we act them out, you're going to injure yourself and your bed partner. And the waves are less organized, brain waves, and faster, and where we dream and get much needed energy. So, and with REM, this occurs under closed eyelids, and the brain waves mimic wakefulness. After 1 hour of falling asleep, the person has more dynamic brain activity, like one is awake. And this is where our brain processes emotions and new learning and motor skills, committing them to memory. Adults need a total of 2 hours of REM a night, and our brain cycles through these 5 stages with 3 or 4 non-REM or light sleep and 1 REM stage where we dream the most. And as we go further into sleep, you'll have longer periods of REM. Right here, probably the longest one just before you wake up. And these cycles of slow wave and REM sleep alternate as a person goes back to stage 2 and then stage 3 and REM sleep, even if you wake up. With each new cycle, more time is spent in REM sleep, and this is why one remembers their dream in the last thing before they wake up. This is why we remember those dreams. Dreams are in dark colors and not vivid, bright, because one's eyes are closed. And when we sleep, the brain processes everything is absorbed during the day, conscious or not, which means that many of us come out here to the villages and learn new things, like line dancing, how to do that, or playing cards, or talking to people, or playing a racket sport. So you practice it during the day, but at night, that's when you learn it. So when people say, I'm going to think about things or sleep on it, that means that they're going to process it during the night, because the brain's always working on something. Infants spend more time in slow wave sleep, and decreasing in adolescence, and even more so in mature adults. REM sleep is a stage of sleep associated with dreaming and memory consolidation. It takes the short-term memories and turns them into long-term memories in your frontal lobe. But deprived REM sleep interferes with memory formation, concentration during the day, and promotes forgetfulness. REM sleep disorders include sleep apnea, narcolepsy, daytime sleepiness, and distressing nightmares, and even breathing problems. So when we dream on REM sleep, that's 4 times generally at night, for about 15 to 30 minutes, dreams are really a succession of emotions, ideas, and images that occur involuntarily during the REM part of sleep. They last between 15 and 30 minutes. Dreams are in real time. That means they're not sped up or in slow motion. In dreams, heart rates increase, breathing can quicken, emotions run high, blood pressure rises, words are sometimes blurted out loud like fragments of sentences. Most people have between 3 and 5 dreams each night, but are quickly forgotten, and their meaning is subject to endless debate. One can recall a dream after being woke up during REM sleep. Dreams can help us solve problems, remember order sequences, advance creativity, act out our anxieties, phobias, suspicions, and can include sexual fantasies. Many consider dreams to be hidden, secret, subconscious desires that are hard to articulate or embarrassing if revealed in public. According to Freud, they're about wish fulfillment. Either way, dreams are about you. Any person you dream about is you. And when people dream, they can work out things. For instance, an artist who's working on lyrics for a song might not have any during the day, but when he sleeps on it, he'll get them later on. And the same thing with maybe an artwork or painting, something like that. And if you're working on a project at work and you sleep on it, in the morning when you wake up, you might have an answer to some of the problems that occur in work or in real life. And sleeping helps you do that because you're working on it as you're going. Now, there's all kinds of different categories of dreams, but falling is a symbol of fear in your life. And it's like fearing a bad relationship or a work-related problem. You need to let yourself go and enjoy life. Are things going out of control with you? Maybe that's why you're falling. Another common one is being chased. Are you avoiding something? Or are you, it suggests one's desire to escape from one's own fears and secret wishes. Now, being chased is a common theme in many action movies, video games, children's games, sports games, track and field, swimming events, baseball, NASCAR races. The list is endless. Dreaming about being nude in public might be where one is afraid of revealing one's imperfections or being a phony. Dreaming about dying is fear of the unknown. Dreaming about failing a work or school-related test means fear of failure. This comes up with school anxiety and performance stress. Dreams about infidelity concerns issues of trust and loyalty with your partner. Fear of flying is a desire to escape reality. Dreaming about water is being overwhelmed and unsupported by those around you. Dreaming about food means you could have went to bed hungry. With your teeth, maybe if you dream about your teeth falling out, it has to do with your appearance and survival instincts. And being lost obviously denotes anxiety. If you dream about another person, you have unresolved feelings. Mainly these will come up also with nightmares also. So many people have reoccurring dreams. These are unresolved conflicts in waking life. 60 to 70% of adults have this dream, mostly women because they ruminate about things more than men because of brain wiring. Women have more connections than men between the right and left hemispheres of the brain. Dreams can have meaning or maybe not. Not every dream is a psychological statement about you. Now, let's talk about the precursor to sleeping, which is yawning. Yawning is an involuntary process that takes in more oxygen. Taking a deep breath fills the lungs with oxygen to help cool a hot brain, cycles blood faster through one's system, and improves blood circulation. Yawning is a simple way for the body to change the state of awareness in one's body. And you often do it before you go to bed to signal yourself to start relaxing, or from being bored, or change from a higher state to a lower one. Yawning is contagious. Most animals yawn. There's a cat I play with next door to me. Whenever it sees me coming, it'll stretch because it knows it's going to play, and it will yawn because that's you take in more oxygen than to stimulate you, to get you going. Now, sleep deprivation is the big one here. This occurs when one does not get enough sleep. Like losing sleep affects performance, like decreased cognitive ability, memory problems, slows physical reaction times, mood swings, and even driving a car as reaction times slow. When you lose sleep, it's like acting like you're drunk. The less sleep you get, the more drunk you'll act the next day. So, can you make up for sleep? Sure. It takes about 3 days to make up for 1 hour. Now, of course, everybody knows you can get a million things done at night, and it's fun to stay up. You can do anything on party, binge watch TV, get projects done. It's great, but you really need to take care of the sleep. This will come up to bite you later on. This is why truck drivers now are limited by law to time restrictions behind the wheel. And when you're sleep deprived, you'll have more fatigue, mood changes, difficulty concentrating, memory problems, paranoia, and even hallucinations. I went to Europe over the summer, and I had severe jet lag, and I was in a real bad mood for a couple hours. There's reasons for this.
Hours. Days.
Good thing it wasn't weeks. Well, the longest recorded time to go without sleep is 11 days. However, after about 24 to 48 hours without sleep, perceptual distortions occur. After 36 hours without sleep, one starts to microsleep for occasional 30-second intervals, much like zoning out. After 48 hours without sleep, appetite, temperature, and mood becomes altered. Decreased attention, fatigue, and risky decisions are made. After 72 hours, the executive functions of the brain are impaired, with bouts of confusion, limiting the ability to think rationally and even process empathy toward others. After 3 or 4 nights without sleep, one starts to hallucinate, have delusions, is irritable, with noticed, eroded motor and cognitive skills, and it's used in torture for enemy combatants. You put them in a cell and blast Britney Spears music at them for 4 days straight, anybody will go nuts. So sleep deprivation includes impaired cognition with higher levels of anxiety, and over time can lead to stroke risk, increased risk for diabetes, increased risk of depression, and weight gain, because you're not doing things, your metabolism is off, and increased risk for heart disease. Now, there's been articles in the paper this summer, 3 of them, depicting what this says. Nix the naps and get 7 to 9 hours of sleep. Proper sleep joins the list of healthy heart habits. So when you sleep, everything gets become repaired in you, and that's a good thing. So that's why they have a normal sleep cycle. But sleeping too much can also not be good for you. The heart doesn't need to rest that much also. So you need the Goldilocks zone between sleeping too little and sleeping too much, and you know exactly what that is for you. And what happens when your brain doesn't sleep? Well, it's easy to get angry, it's easy to lose your memory, slurred speech, and make risky decisions. Simply put, you act stupid the more sleep you lose. There are a number of famous people in history, though, that got by on very little sleep. Inventor Nikola Tesla needed 2 hours of sleep. Unfortunately, he had mental and emotional problems later on. Leonardo da Vinci took 20-minute cat naps every 4 hours throughout a 24-hour cycle. This is called polyphasic sleep cycle. Thomas Edison took 30-minute power naps every 6 hours and thought sleep was a waste of time. Winston Churchill took long daytime naps and worked through the night. So, if you sleep too long, it's not good. If you sleep too less, it's not good also. And let's get into some specific sleep problems. Insomnia refers to the inability to fall asleep. As many as 10% of people have this condition. There is short-term insomnia and chronic insomnia, which is defined as happening 3 times a week for 3 months or more. Either way, adequate sleep is denied and daytime functions are impaired. This can evolve into a state of hyperarousal. You don't get enough sleep, you seem like you're always on edge and are always jittery about things. And often impacts mental states like rational judgments, moods, and activities. And then there's snoring. We all maybe have a partner who snores. Of course, I don't. Snoring is a noisy breathing while you sleep and often disturbs the sleep patterns of your partner. Snoring happens when the flow of air through your nose and mouth is blocked. This could be by blocked nasal airways, like a sinus infection, poor muscle tone in your throat or tongue, bulky throat tissue from being overweight and too fat, a narrow opening between your nose and throat causing vibrations, or sleeping on your back. Either way, uvula vibrates, which is at the base of your tongue, and that's where you get the noise from, primarily that. So, how do you solve this? Options for this include possible surgery to remove excess throat tissue, or things you can get online, for instance, nasal strips to help you out with your nose, an oil you can breathe, chin straps, a mouth guard, or even breathable nose plugs. Now, sleepwalking is a parasomnia, or a type of sleep disorder that involves abnormal behaviors or movements when asleep. 8 million people in the US have this, which is called somnambulism, and more common with kids, 10 years old or less. Sleepwalking episodes usually occur a few hours after falling asleep, that is, in the beginning of sleep. This is the state between wakefulness and sleep, and before a sleepwalker enters the beginning of deep sleep, and before REM sleep, then the brain produces slow delta waves or slow wave sleep, making it harder to be awakened. So what happens is a person sleepwalking is truly asleep and usually gets up from bed and walks around in a zombie-like way. The arms are out in front because that's our evolutionary way, again, of not being heard. And then there's nightmares. I know you've had nightmares, everybody has them, and they're particularly disturbing and frightening and are considered a sleeping disorder when they occur frequently. Nightmares are similar to regular dreams, but involve images and imagined sounds that produce anxiety and fear. Being anxiety-related, the dreamer often wakes with a good recall of the psychologically upsetting dream. Sometimes words are blurted out with stressful situations rehatched. They could be interpreted as dress rehearsals or rehearsed confrontations in real life, or interpreted as working through upsetting events. These scary dreams occur during the REM sleep later on at night and are more common in children as adults grow out of them. And compare this with night terrors or sleep terrors. They are episodes of screaming, intense fear, and flailing while asleep. And they are called a parasomnia. They can be related to anxiety issues, phobias, and perceived physical threats. They occur in 40% of all children, and they last a few seconds to a few hours, to a few minutes, They occur in the first half of the night. So night terrors occur in the first half of the night, and nightmares in the last half of the night, and usually kids outgrow them, usually. And sleep paralysis is a state during waking up or falling asleep in which a person is aware but unable to move or sleep. And it lasts usually a few minutes. It's caused by interrupted REM sleep, where our muscles lock up, and so you're frozen in place for a little bit. There's another one called silent heart attacks. These can occur during sleep as a person having one may not sense or feel it. The heart muscle is not getting enough oxygen and becomes damaged and not able to effectively pump enough blood. The silent killer can cause cardiac death. The heart does not know if it's daytime or nighttime, so this is when it happens. For men, it's easier to detect, but for women, it's harder because most cardiologists are men. And in addition, my aunt, my mom's sister, had a silent heart attack at night and died. This left my mom without a sense of closure to come by and say goodbye. So this can affect people in a very bad way of people living. And then there's people experiencing with dementia or Alzheimer's disease have impaired sleeping. You see, sleep plays a big role in the brain. It clears away metabolic waste products called beta amyloids that are in the brain fluid here. And what they do is, this means plaque is allowed to build up in the brain, and poor sleeping causes neurons not to find pathways to pass information. Impaired sleep can cause impaired thinking over time, usually with older adults. Now, many of us know someone who's an older woman generally, in her 50s or 60s, and when you talk to her, it's like her, the diplomatic filter on her has been taken off. And that makes negative comments a lot of times and seems out of place. And that's onset dementia, by the way. And this, I just picked this up on chronic traumatic encephalopathy from getting hit in the head too much. This can also affect your sleeping. Your brain's not thinking right. This will happen with athletes primarily. This is what a brain should look like. And when you have contact sports, and even with dementia, which is the same as having a contact sport. The prize fighter Muhammad Ali had Parkinson's and advanced CTE for 35 years of his life. And there's also night sweats. It's sweating at night, soaking your clothes, bed sheets, and they could come from hot flashes, the room is too warm, or having a fever with chills. I had night sweats when I took the shingle shot. My body couldn't determine if I was hot or cold, so I started to sweat. After a person has a stroke, excessive sleeping may occur. This drowsiness is a normal part of recovery as the brain devotes more energy into healing and repairing damage done. Deep REM sleep helps the brain process motor information. The brain then transfers these short-term memories about muscle movement to the temporal lobe, where they become long-term memories as discussed. This then helps the brain relearn skills that were lost during the stroke. For instance, a stroke victim might have temporary paralysis of one side of the body or even a speech problem. And proper sleep can help partially restore these motor skills and thoughts. So sleep is a good way for the body to heal itself. Now, then there's bedwetting, or involuntary urination during sleep, is a problem with millions of children. This causes include anxiety, school phobias, separation anxiety, food allergies, eating, and drinking habits, urinary tract infections, and sleep apnea. Bedwetting with adults affects 5 million Americans. It can be attributed to genetics, a small bladder, medications, or stressful situations. Now, the actor Michael Landon from the TV series Bonanza had a bedwetting problem as a teenager, and he made a film about it called The Loneliest Runner in the late 70s that I watched. And I was moved by it because as a teenager, he'd wet his bed and his mom would hang out his bed sheets in the backyard. And when the kids came walking home from school, they would see these sheets and then make fun of him. So what Michael did was he would run home as fast as possible to get those sheets down and avoid embarrassment. He became so good at running, he didn't become a long-distance runner, but instead he became a javelin thrower, which means you need intense speed quickly. And he had Olympic hopefuls. He was so good, but then he went into acting. So this does affect real people in real situations. Now in fainting, you do not sleep, but you are temporarily unconscious for a short period of time. With a coma, though, is a long period of unconsciousness while being unresponsive to sounds and pain. The brain is not working properly, and as a consequence of a head trauma or brain problems, there are different kinds of coma induced maybe by severe accidents, low blood sugar levels, oxygen restriction after a heart attack, some caused by illness, and a vegetative state or a mentally induced coma is where a person receives anesthetics over time to reduce brain swelling. You are also not asleep under anesthesia. It makes people unconscious but unaware of pain and trauma, but not asleep, with the brain being in a stalemate with information flow. Just the opposite with sleep, as mental activity is high. The singer Michael Jackson 12 years ago had a problem with sleeping, and his doctor gave him propofol, which is a anesthesia. He took it for 60 days straight and died. And his doctor, Dr. Murray, then was sued for malpractice and disbarred for doing this. Obviously, you only take it when at a hospital. African sleeping sickness, or trichomoniasis, is caused by microscopic parasites transmitted by the tsetse fly in sub-Saharan Africa. It gives victims of extreme fatigue and tiredness as it promotes sleep and can be treated with antibiotics. Now, smoking pot or weed can frequently lead to sleep problems, like sleeping longer than 8 to 9 hours or less than 6 hours at night. These kind of sleep patterns over time can lead to strokes, diabetes, and coronary artery disease. There's a link between the active ingredient in pot, which is THC, and poor sleep. And so when you take the THC out of it, you get medical marijuana, which has helped millions, and legal. And when you take the THC out of it, you get CBD oil, which makes you drowsy, that can help you sleep. These gummies also have CBD oil in them, for instance, that you can take. So there are different kinds of way to take it. Too many studies with too much pot smoking, like 3 or 4 times a week for years on end, can develop into severe psychological problems. Obviously, the brain's not equipped to do that. Sleeping with a pet for adults can help reduce stress and provides feelings of security and comfort. Their nocturnal movements at night might wake a person, and they might bring more allergen in one's bed, plus spread germs, and also they spread ticks and fleas. Pardon me. Got the L in the word. And speaking of bugs, you have bed bugs, and they eat the flakes of skin at night off your body, and they'll sometimes bite you with small bites that can cause painful itching and scratching. So you might want to wash your bed sheets. And then there's wet dreams. They're usually associated with adolescent boys during puberty due to hormonal changes. Though women can have them too. This concerns a person having an involuntary orgasm during sleep, which may or may not be erotic. They are a natural occurrence and cannot be controlled or stopped. Sleep issues can also happen with PTSD, where a person has a heightened sense of arousal after a traumatic event. The event can be associated with an emotional response or to some physical force. Veterans and victims of all sorts exhibit this mental tragedy. You don't have to be in war to have PTSD. Someone you love could leave you. Something terrible could happen in life, and you replay these nightmares all the time. And this can manifest itself with insomnia and nightmares as the mind plays out fears, replaying the form all over again in some altered form. Memories and emotions are not processed properly during sleep, and you'll have, with PTSD, you'll have dysregulation, excessive hyperactivity, micro-awakenings, breathing disorders, conditioned fear of sleep because you don't know what you're going to dream, and nightmares. So this then leads to having people with confusion, paranoia, and irrational thinking with PTSD, and sometimes then you read about it in the newspaper, and then you wonder why. Sleep disorders also in psychiatric patients, there's a link between insomnia, depression, and not getting the proper sleep. The mind is not working properly, something is wrong. And there's also narcolepsy, which is a chronic sleep disorder consisting of an overwhelming daytime drowsiness and sudden attacks of sleep. This neurological disorder affects the brain's ability to control sleep-wake cycles. People with narcolepsy can fall asleep for short periods of time, anytime, anywhere, and makes obvious disruptions in work or daily routine. These are uncontrolled slight naps. When I was young, I had a friend named Alan. Alan, in grade school, he would have narcolepsy, and we tease him a lot in school about it. He didn't like it and wouldn't want to do anything with us, so we ended up stopping talking about it. A lot of people here in the villages take naps. Between 30 and 60-minute naps in the afternoon. This does boost energy and does improve cognitive functioning. However, excessive daytime napping could be underlying symptoms of sleep deprivation, poor sleep habits, depression, sleep apnea, cardiovascular issues, and early signs of dementia and even diabetes. Now, this is what I recommend the most, is hypnosis. When a person is hypnotized, they are not asleep, but aware of their actions. However, two states of mind become evident. The conscious mind is present, but not active as being awake. One's subconscious takes the lead and becomes more open to suggestions. During hypnosis, one enters a trance state or an altered state of consciousness where one zones out, and then you would take suggestions from another person right by you to help you out with problems like smoking, panic attacks, depression, alcohol problems, eating disorders. A lot of sports people take this to help out, convince themselves with motivation that they are very good at what they do because the mind is the key. And I'm recommending this because there is no gizmos, no drugs, no pain. Now, a pulmonologist is a doctor that specializes in lung conditions. They focus on the prevention, diagnosis, and treatment of conditions related to the lungs and respiratory tract. They are not heart doctors like cardiologists, but are sleep disorder experts and treat sleep apnea. By having a patient take a sleep test in a sleep lab, they can test a patient's heart and lung activity while sleeping. This concerns an overnight stay in the sleep lab that is safe, clean, and orderly. There's one here in Spanish Springs. Now, in this sleep lab, it is conducted by a sleep specialist. While sleep is being monitored with a polysonogram with wires and electrodes attached to the head and chest. This checks out vital signs like breathing, body temperature, heart rate, and number of times sleep is altered, disturbed, or interrupted. All this is observed by a lab tech in the next room with the result given and noted to the pulmonologist. Based on the results, a variety of options can include, and this is what it looks like, and you're in a clean, safe place. You get there about 9 o'clock at night, they hook you up with electrodes, you fall asleep, they wake you up about 5:30 at night and take you, and you get back home at 6, and that's how you spend your night. And with that information, then they know what's going on with you. And this concerns a lot of times with sleep apnea. It's a sleep disorder in which breathing stops and starts. Apnea is a disruption of sleep and causes the person not to get a good night's rest and even bothers their sleeping partner. There are 3 types of apnea. The more common one is obstructive apnea, where the throat muscles relax. Central sleep apnea, where the brain does not send proper signals to the muscles that control breathing, and complex apnea that includes both. Now, causes of this are things like obesity, family history, hormonal disorders, alcohol use, a recessed chin, COPD, smoking, sleeping on the back. 22 million sufferers have this in the United States. About 80% of them are undiagnosed. So these are some of the symptoms from it, but some of the symptoms. Now you these are, a number of products are available to those who suffer from sleep apnea. The most popular is a Cpap machine, or a continuous positive airway pressure machine that sits next to one bedside. This compact machine sends a flow of air through a tube attached to a mask around the face that would help out, and would look like something like this. And the machine there then sends warm, moist air into the person here. The machine, it uses distilled water to do this, and is portable, and you can take it with you when you go on vacations or elsewhere. And there's also one with nose pillows, which look like this, and this just goes directly to the nose. So if you have this attached to you, then it'll also, you go to a website in the morning and find out what personally happened with your sleeping. Did you have micro awakenings? How many of them were there? How many times did you get up? How many times was your sleep disturbed? So it's a good way to check on what's going on with you. There are other devices too, like INAP. Another device called Impaired consists of two devices planted just under one's skin in the chest or rib area to handle obstructive apnea. It sends small electrical impulses to your nerves while you sleep to open airways, and is remote controlled by the sufferer. Right there. Another device, INAP, uses nerve stimulation and negative pressure which creates a vacuum to gently roll the tongue upwards to the palate to open airways. Air sleep is a small, lightweight air pump that attaches just under the chin, around the jaw, to regulate breathing. There are also other devices you can get, like nose clips, a device to keep you from rolling on your back, mouthpiece, mouth tape, some monitors, and a chin guard. You can also get blackout curtains to help you get a proper night's rest. And the way you sleep does say something about you. Psychologically, sleep positions are important. Most adults, or 60% of them, spend their nights sleeping in the side position, like A, B, C, or these here. Sleeping in the fetal position, like in the womb position, like this and like this, these sleepers tend to be more anxious and worry more and emotional. Sleeping in the log position, right there, with arms and legs extended, the sleeper tends to be sociable and trusts others easily, or is gullible. And sleeping on the back, like the soldier or starfish position, like there and there, like there and then there, the sleeper tends to be are quiet and good listeners. As few people sleep on their stomach, it's harder to breathe that way. And you can use pillows to help you out sleep. For back pain, you want to elevate the legs. For high blood pressure, maybe the head a bit. For sinus trouble, obviously you elevate the head. Shoulder pain, favor one shoulder. And babies should always sleep on their backs, never on their stomachs, because this will contribute to SIDS, and never with a toy or a animal with them. So there are factors that contribute to not getting a full night's rest. These include medications, heavy meals before bed, loud noises, too much light in the room, drinking caffeinated beverages before bed, exercising before bed, staring at computer screens at night, cell phone next to you, a snoring partner, crying baby, or high stress events that concern your health or other people's that you love, work problems, phobias, money problems, or even a bad mattress. So, there are tips for healthy sleep. These are just common sense things to do. Have a regular go to bed time and then wake up time. Maybe take an evening walk. For me, it's brushing my teeth and then reading. And then maybe a comfortable bed, cool conditions, and relaxing, like taking a bath. But say no to heavy foods, cell phones, training, that is exercising, alcohol, and stress and caffeine. So foods to help you go to sleep at night would include things with tryptophan and calcium and magnesium, which is milk, or very light carbohydrates. Stay away from heavy meals like protein that stays in your body a very long time and stimulates you. And say no to sugar and caffeine. No, sleep is not for sissies. No. So we've gone over many of these problems here that you can identify. Don't need to list them. And how to get a better night's sleep. So there are very practical things what to do. Maybe shift into a bedtime mode for relaxation with soothing and unwinding and stress-free thinking that includes imagery. Maybe taking a bath, or maybe a sleep aid even, and maybe listening to a tape of ocean waves, running water, or soothing, tranquil music can help out. And thinking in your mind about this imagery, like a stream. The stream stream sounds and ocean waves are very repetitive and help you go to sleep this way. It's also very natural because that's what you hear as a baby in your mom's womb. And there's also practice yoga. This is all about breathing and will help you concentrate on your breathing, which will make you fall asleep. Once you think about your breathing, that's the whole key, what's going on here, or maybe even read a book. And you can buy tapes to help you out sleep, just help you sleep, like relaxing rain sounds, music to help you sleep and relax, ocean sounds. These are some hints that we've been over, but breathing is the main one, because you want to think about how to breathe. Try slow, deep belly breathing by placing your hand on your belly and inhale deeply as you count to 4. Fill your belly as you inhale and try to keep the chest still as you breathe. Hold your breath for a 7 count and then exhale as you count to 8. Breathing and counting will make you sleepy. They are repetitive acts. What I do is sometimes I think about how my lungs are in my body, what they look like, and then I picture them going in and out, them expanding and contracting, and that's repetitive and slow and natural. There's also sleeping pills like Ambien, Lunesta, are prescribed worldwide and used by millions of people, a billion-dollar business. They are known as sedatives, sleep aids, and tranquilizers. They cause drowsiness. They are called downers in our days. They're about 50% effective, with many users just getting a placebo effect from just taking the pills. But that can lead to dependence on them and can cause lingering daytime lethargy, loss of attention, and sometimes sleepwalking. So, in other words, you might be out of it during the day after you take one of these things like Unisom, Xanax, Lunesta, Quietude, or Ambien. And here's one on infomercial on Relaxium, made by this. On another note, when I'm trying to get pictures for this slideshow, and someone like her, a white young woman always appears in these pictures that I try to get for you. And it's always somebody between 25 and their early 30s, a handsome man or a woman. But those people don't have sleep problems. We do. But they're never anything of older people. And where are the Asian people, black people, the Native American? Do they have sleep issues? I guess not. But that's just a commentary. Okay, so there are numerous products that can enhance your quality of sleep. These include products like pillows, mattresses, even pajamas, wearing an eye mask like this. They even give you these on a plane. That can help out. Block out light. There are special pillows for sleep apnea to elevate the head for better sleep quality. Some pillows alleviate neck pain, pillows for pregnancy, and snoring. Side sleepers, you choose a firm, thick pillow. Stomach sleepers, a soft, thinner one. There's also wedges you can buy in case you have a neck problem or some kind of an injury, and as well as ones for the legs in case you have thrombosis or serious varicose veins. So there's different shapes of them. Actually, there's 100 different kinds of pillows that you can buy. And there are gel cooling pillows, some made from natural organic materials, and some made of foam, latex, and fiberfill. So construction and fill matter. There's even pillowcases and the thread count being important. They should be replaced every few years because your weight depresses them and makes them not usable that much. So when you sleep, 75% of your weight, 2/3 of it is between your shoulders and the top of your thighs. So having a good mattress helps out. Sleep Number bed is one of the best beds. It'll have 2 separate sections on it for each partner, and it has like an air mattress in each section, and you can adjust it to put in more air to make it firmer and less air to make it softer. So I recommend that, but they cost a fortune. And the construction looks like this, where you have more airflow between things also. I recommend also a water bed. There used to be one big glob of mess back when we were young, but now they have tubes in them, and this will help sleep because it's like being in the womb. You're just supported by water. So I would recommend this. They've made the quality much better of them nowadays. And some have mattresses where you can sit up and then lie down to read and then relax. And there's also PJs that you can buy. Some keep you warm. Some are silk kind that can keep you cool. They form a protective layer between you and the bed sheets. They have cooling blankets that do not trap heat. And then there's the products, the heat, about sleep, which I want to get into. You can buy chewable sleep tablets for your child with melatonin in them. You can put your toddler or baby on a vibrating pad, remote control, and have them vibrate. Rockabye, forget the lullabies, and just say, vibrate my baby. And you can have sleeping, soothing sounds coming from whatever there. And then you can have a night light to help sleep baby. And then there's the magnetic therapy pads, which I've been to these talks. People think that there's a lot of iron in the blood. There's about what amounts to be a small nail full of iron in your blood. Magnets do not help you at all fall asleep, and they're just silly products to waste your money on. And the same with other flaky products that we see here sold by the Gem and Minerals show actually sells these things. Magnetic bracelets, I mean really, for lymph drainage. These are bogus products. Magnets don't help you do anything at all, don't soothe you, don't relax you, don't do anything at all. And the same thing with meditation beads or anything with quartz crystals on them, putting on you to make you calm and relaxed. They don't do anything at all, but if you believe in them, they will. And the same thing with heart-shaped quartz crystals. They have nothing to do with romantic relationships. Just because they're pink and heart-shaped doesn't mean they're going to help you out. Because quartz has vibrating properties to it. And there's various products that you can buy. Earplugs that actually are comfortable. Same thing with headphones and sleep systems that you can get. Moisture wicking sheets, special light bulbs, an air purifier, and my favorite one for the person who just wants to call a boyfriend pillow. Just what every woman wants, including with a guy with 6 packs and breasts that are, my God, they're enormous. And then just put your arm around that and you got yourself a boyfriend and a girlfriend. Okay. So if you get them for people, why not for animals? How about sleep aids for dogs, melatonin? Same thing, chewing calms, sleep aids for pets like calm and relaxing music for them, sound therapy, hemp oil for dogs and cats, and crystal healing for animals. Imagine putting crystals on your cat to make it go to sleep. Good luck with that. This is true. Acupuncture can help you optimize your sleep patterns. You could try that also. Speaking of different ways, natural ways to help you go to sleep. Now, and winding this down, hibernation, when animals hibernate, they're not asleep. They're in what they call torpor, which is an extended time of decreased activity. They're not always still. Sometimes they move around to give birth or use the bathroom. Bears, bats, turtles, bees, skunks, mice, squirrels, all hibernate. So the metabolic rate drops and their body temperature does, along with the heart rate and breathing, to conserve energy during winter months. The brain waves during hibernations look a lot like when they're awake, but much, much slower. Also, you don't sleep in suspended animation. This is a science fiction thing. You're wondering, you're watching these movies where everybody goes to sleep and travels for 100 years, so they're in this kind of state, and what they do, they take out the blood and recycle it with a cooling liquid, and they give you oxygen. This has been done with some animals, some mice and things, for a few days, but it hasn't been tested on humans. But that's what happens in science fiction movies. So today we've learned a lot about sleep, some problems associated with them to get a good night's rest. I believe in the near future we will even learn more about sleep, and thank you very much. That is the end of this presentation. Thank you.
Thank you, Greg.